The endocrine system is essential to the regulation of the body's internal environment. Through hormones secreted by its glands, the endocrine system regulates such varied roles: growth, reproduction, metabolism, fluid and electrolyte balance, and gender differentiation. This adapts constantly to the evolving and fluctuating changes in the internal and external environment. The thyroid gland is located right here. So that is anterior to the upper portion of the trachea and inferior to the larynx. It is butterfly-shaped with two lobes connected by a band of tissue called the isthmus. The thyroid secretes thyroid hormones, triiodothyronine, which is T3, and thyroxine, which is T4. TH secretion is initiated by the release of TSH in the pituitary gland. The primary role of thyroid hormones in adults is to increase metabolism and controls the rate of metabolism, growth, and development of all tissues. It also secretes calcitonin, and that is a hormone which decreases excessive amounts of calcium in the body by slowing the release of calcium by the bone cells, and a marker for sepsis. Hyperthyroidism, or thyroid toxicosis, is a disorder caused by a delivery system of thyroid hormone T3 and T4 to the tissues. The primary effect of TH is to increase metabolism and protein synthesis. Therefore, hyperthyroidism affects all major organs. The increased circulating levels of TH increase metabolism rate and heighten sympathetic nervous system's physiologic response to stimulation. This increases cardiac output and stroke volume, therefore increasing cardiac output and peripheral blood flow. Elevated TH levels increase carbohydrate, protein, and lipid metabolism. So if you think of it this way, everything is revved up, putting the body into overtime and causing an increase in calorie and nutritional deficiencies. The manifestations include increased appetite, typically weight loss, hypermodal bowels and diarrhea, emotional lability, heat tolerance, insomnia, palpitations, and increased sweating. Skin is smooth, warm, and hair is fine with some hair loss in the scalp. So this is Faith Ford and Gail Davers, and this one in particular, she is an Olympian, but they both have Graves' disease. So the most common cause of hyperthyroidism is categorized by what type of disorder. So the answer to this is autoimmune. Hyperthyroidism results from many different factors, including an autoimmune stimulation. This can be from excess secretion of thyroid-stimulating hormone by the pituitary gland, thyroiditis, or neoplasms. Side effects of certain medications can also cause this, as well as excessive intake of thyroid medications. The most common etiology is Graves' disease. Graves' disease may also be associated with other autoimmune disorders such as myasthenia gravis, diabetes, and pernicious anemia. Serum studies will reveal an antibody that binds to TSH receptors in the thyroid follicles, creating the stimulation of hormone synthesis and secretion. This causes thyroid cells to hyperfunction and an enlargement of the gland. The cause is unknown, and it's typically a hereditary link. It can be associated with an increased iodine intake. It is seen 8 times more often in women than in men, and typically between the ages of 20 and 40. Graves' disease has the same manifestations as hyperthyroidism. The nurse correlates which manifestations with the diagnosis of hyperthyroidism. You can pause the video and think about this for a minute. So the answer is going to be nervousness, weight loss, and tachycardia. You will see an increase in appetite, weight loss, although initially they can have weight gain, hyperactive bowel sounds, diarrhea, heat intolerance, insomnia, palpitations, and increased sweating. The skin is smooth, warm, and fine hair. including on their eyebrows and their underarms. There are many manifestations. So for cardiac, we see systolic hypertension, tachycardia, palpitations, dysrhythmias, AFib, angina and heart failure, and dyspnea. They're going to be short of breath. This manifestation is called exophthalmosis. So this is caused by edema of fat deposits behind the eyes and inflammation of the extraocular muscles. Proptosis is a forward displacement of the eye from the accumulating pressure, forcing the eyes outward from their orbits. It's typically bilateral. The characteristic is an unblinking stare. The treatment for Graves' disease may stabilize these symptoms, but generally this is not reversible. They may have blurred vision, diplopia, which there's 2 images instead of 1, so they're going to have double vision, eye pain, and photophobia. That is an extreme sensitivity to light. Inability to close their eyes over protruding eyeballs increases the risk for dryness, irritation, infection, and ulceration. The muscles which move the eye and the optic nerve change and may lead to eye paralysis as well as vision loss. The GI manifestations are going to be increased appetite with weight loss, thirst, hyperactive bowel sounds, as well as diarrhea. Additional manifestations are going to be fine tremors, nervousness, hyperactive deep tendon reflex. We already talked about the ophthalmosis, fine, soft, silky hair, and the periorbital edema. So this is a goiter. A goiter can sometimes occur when your thyroid gland produces too much thyroid hormone, such as in hyperthyroidism or Graves' disease. In someone who has Graves' disease, the antibodies produced by the immune system mistakenly attack the thyroid gland, causing it to produce excess thyroxine. So other manifestations include amenorrhea, a decreased libido, weakness, fatigue, the smooth moist skin, the goiter that we've already discussed, increased temperature, and insomnia. All of these manifestations on these previous slides should illustrate to you just how powerful and significant the thyroid is in the body. Diagnostics. The following labs are diagnostic criteria of hyperthyroidism. Select all that apply. So elevated levels of TH, and that's going to include both T3 and T4, and increased radioactive iodine uptake are diagnostic criteria for hyperthyroidism. Radioactive iodine is a direct measure of thyroid activity because the thyroid takes up iodine. Therefore, hyperfunction equals increased iodine uptake. So the normal T3 levels are going to be 80 to 200, and it's going to be increased in hyperthyroidism. For T4, we're looking at 5 to 12, and it's also going to be increased in hyperthyroidism. You can also examine TSH level to differentiate between pituitary or thyroid dysfunction. In primary hyperthyroidism, TSH level is decreased. This hormone is secreted from the pituitary gland with the purpose of stimulating the thyroid to produce thyroid hormone. The pituitary constantly monitors our thyroid hormone levels, and if it senses the slightest excess of thyroid hormone in the blood, it stops producing TSH. Consequently, a low blood TSH strongly suggests the thyroid is overproducing hormone on its own. If it's due to pituitary tumor that leads to dysfunction, then you may have an increased TSH leading to hyperthyroidism. They can also perform an MRI to identify any thyroid tumors. In interpreting a radioactive iodine uptake test, A nurse should know that is there going to be an increase or a decrease with Graves' disease? You see, you already have your answer here. It's an increased uptake seen in Graves' disease. So your nursing considerations for this is not to eat or drink for 8 hours prior to the test, but can eat 1 hour after oral dose is given. Radioactive iodine is given orally or IV, and thyroid uptake is measured with a scanner at hourly intervals and then again at 24 hours. The patients would stop any thyroid medications they're taking for several days before the test, and no seaweed or vitamins which contain iodine for 4 to 6 weeks before testing. Which principle supports the treatment of hyperthyroidism with radioactive iodine? So the thyroid gland takes up iodine in any form, and radioactive iodine concentrations in the thyroid gland, creating damage and destruction of thyroid cells, thus creating less TH. Anti-thyroid medications are going to reduce thyroid hormone production. So the tapazole and the PTU are going to inhibit TH production. Advise your patients not to take these during pregnancy because they will cross the placenta. Therapeutic effects of thyroid medications are going to take several weeks. Iodine sources, these damage and destroy thyroid cells so that less TH is produced. This is done in the hospital, but many organizations are moving to outpatient or home settings where large doses are given. It may take up to 6 to 8 weeks for results of the treatment. The amount of gland destruction cannot be readily controlled, and they may develop hypothyroidism, requiring lifelong TH replacement. Once again, these clients can't be treated if they're pregnant because the iodine is going to be crossing the placenta, causing fetal thyroid gland disruption. It can be taken preoperatively, decreasing the vascularity and the hyperplastic thyroid, as well as when the patient is in thyroid storm. And that's when an excessive state of hyperthyroidism is happening due to patient experience a stressor. That is a life-threatening condition. Your client has a history of hyperthyroidism and atrial fibrillation. The nurse educates the patient on signs and symptoms of bleeding because number 2 is correct, because it causes an increase in the anticoagulant effect. You want to educate your patient on reporting signs of bleeding and compliance with any Coumadin lab monitoring. So for any cardiovascular effects, they're going to place the patient on propranolol, and that's to rapidly decrease the cardiovascular manifestations associated with hyperthyroidism. Beta blockers like propranolol or ismolol are part of a prescribed initial treatment for hypertension, tachycardia, dysrhythmias, and palpitations. The nurse monitors for which of the following as indicative of effective treatment of hyperthyroidism? So number 3 is going to be correct. You want your patient to have a decrease in the heart rate. So if they're going to be on the propranolol, you want the heart rate to come down into the expected range. A total thyroidectomy can be performed if there is an extensive tumor, pressure on the esophagus, or trachea creating breathing or swallowing issues. But typically a subtotal thyroidectomy is done. This leaves potentially enough of the gland in place to produce an adequate amount of TH. If total is performed, they must have lifelong hormone replacement. Following a thyroid resection, the nurse frequently assesses the client's ability to speak. What is the nurse evaluating with this intervention? So you're looking for a spasm or edema of the vocal cords. That tests for laryngeal nerve damage. The location of the nerve increases risk of permanent damage during surgery. Hoarseness may be due to edema or ET tubes, and this will subside. Which of the following are most important to monitor in a client who has undergone a total thyroidectomy? So with a total thyroidectomy, you want to make sure you're monitoring your pulse, temperature, and blood pressure. You're watching for hypovolemic shock from hemorrhage. Assess your dressing and the area behind the neck and shoulders for drainage due to patient positioning. The vascularity of the gland increases risk for hemorrhage. Serum electrolytes due to hypocalcemia and tetany, and that's going to be the spasm you see from a low calcium level. This can be due to removal or damage of the parathyroid glands. Signs and symptoms of this are going to be tingling in the toes, fingers, lips, the positive spastic sign, a twitch, that's going to be that twitch in the facial muscle when you're tapping, the Trousseau sign, that's where you're inflating your blood pressure cuff above systolic blood pressure for several minutes, and it causes muscular contraction of the arm and hand. Those are going to be those two videos you watched in your fluid and electrolytes lecture. And the parathyroid glands are located in and near the thyroid gland. This may create injury or removal of the glands, resulting in hypocalcemia. You want to have calcium gluconate or calcium chloride ready and available, and this can happen from 1 to 7 days post-op. So before their surgery, you're going to give their anti-thyroid meds or their iodine meds, and then you're going to start your teaching preoperatively. You're going to tell your client to expect to be hoarse due to swelling. Allow them time to ask questions, and then teach them to support their neck with both hands. Post-operatively, you're going to be watching out for hemorrhage. You're going to be assessing your dressing, monitor blood pressure, pulse, heart rate, and their labs. Respiratory obstruction is also a concern with hemorrhage or edema. A client with thyroid cancer undergoes a thyroidectomy. After surgery, the client develops peripheral numbness and tingling and muscle twitching and spasms. The nurse should expect to administer, and it's going to be IV calcium because of hypocalcemia. And then here is the instructions for eliciting the spastic sign and the Trousseau sign. I would encourage you to go back to the first lecture of fluid and electrolytes where those links are and watch those two videos. So Missy has lost over 15 pounds in the last month related to her hyperthyroidism. A dietitian orders a 4,000 calorie a day diet. What is the rationale for this? So the answer is going to be number 3. The client needs a high calorie diet to help balance her metabolic state. Remember, these clients are using quite a bit of calories. These are going to be some of your nursing diagnosis. When I think of nursing diagnosis, I think of what I'm going to be doing for the client while they're under my care. So the first one is going to be risk for decreased cardiac output, and that's going to be because of the tachycardia. Disturbed sensory perception, that's going to be visual. Think about what's going on with that ecthylomosis. Imbalanced nutrition, that's going to be due to an increased metabolism and weight loss. Think back to our previous question when Missy was placed on a 4,000 calorie a day diet. And disturbed body image. Think about the goiters and the hair loss, the fatigue, the ecthylomosis, and the weight loss. A nursing student is studying for a test on the care of a client with endocrine disorders. Which of the following statements demonstrates an appropriate understanding of hyperthyroidism? So looking at this question, we know that Graves' disease is the most common cause of hyperthyroidism, not hypo. For the third answer, increased renal blood flow and glomerular filtration. So we're looking at the opposite of what this question is asking. And the last one, increased amounts of TH cause an increase, not a decrease in cardiac output. So we can see here that the first answer is the correct one. So next we're going to be talking about hypothyroidism. So hypothyroidism is a disorder that results when the thyroid gland produces a blank amount of TH. So the answer to this is going to be insufficient because of a decrease in TH levels. That decreases the metabolic rate and heat production, affecting all body systems. This is most common in women between the ages of 30 and 60 years of age. So hypothyroidism can either be primary or secondary in nature. Primary is going to be the most common, and it is caused by thyroid gland dysfunction, congenital defects in the gland, loss of thyroid tissue following treatment for hyperthyroidism with surgery or radiation, and anti-thyroid medications or thyroiditis, which is an inflammation of the gland. And also certain medications can cause this. Secondary causes of hypothyroidism, that results from pituitary TSH deficiency or peripheral resistance of thyroid hormones. Hypothyroidism has been known to have a slow onset with manifestations occurring over months or even years. With hypothyroidism, we're going to see a decrease in T3 and T4, but especially the T4. We will see an increased level of TSH if this is caused by the thyroid because the pituitary gland is trying to make up for the decreased levels. You'll see a decrease in TSH if it's caused by the pituitary or the hypothalamus. You're going to do the same labs and tests as you would for hyperthyroidism, but they're going to have the opposite results. You may also see an increase in cholesterol levels because of deficient amounts of TH causing abnormalities in lipid metabolism. You might also see anemia, hypoglycemia, and hyponatremia due to decreased renal blood flow and glomerular filtration rate from a reduction from atherosclerosis and cardiac disorders creating sodium alterations. The most common cause of hypothyroidism in the U.S. is Hashimoto's thyroiditis. This is most common in women with possibly being genetically linked. It's an autoimmune disorder in which antibodies destroy the thyroid tissue. Goiters are common due to a decreased production of thyroid hormone, creating the thyroid gland to enlarge as a compensatory attempt to produce more hormone. Usually it's simple or non-toxic form. Which of the following medication is associated with hypothyroidism? The answer here is amiodarone. It actually contains iodine. So iodine is trapped by the thyroid follicular cells, causing a disruption of thyroid hormone synthesis and resulting in direct damage to the thyroid cells. Blank is a life-threatening condition triggered by acute illness or trauma and is associated with untreated hypothyroidism. Myxedema coma is a life-threatening complication of long-standing untreated hypothyroidism. It is characterized by severe metabolic disorders, hyponatremia, hypoglycemia, and lactic acidosis. Also hypothermia, cardiovascular collapse, impaired cognition, and coma. These individuals are extremely sensitive to opioids and may die from normal doses. This usually occurs in the elderly. The treatment for this is to address any precipitating factors and manifestations. You want to protect their airway, maintain fluid and electrolyte balance, acid-base balance, and maintain cardiovascular status and monitor their body temp. Even with aggressive treatment, mortality is high. Lactic acidosis is when lactic acid builds up in the bloodstream faster than it can be removed. Lactic acid is produced when oxygen levels in the body drop. When admitting a patient with hypothyroidism, which assessment finding by the nurse correlates with this diagnosis? So it's going to be the lowered temp. Typically, these patients have bradycardia, coarse, dry skin, and weight gain. Cardiovascular manifestations include bradycardia, decreased cardiac output, chest pain, hypotension, atherosclerosis, and cardiomegaly. Cardiomegaly is going to be from the accumulation of fluid in the pericardial sac. Additional manifestations are going to be constipation related to decreased peristalsis, decreased appetite, weight gain, that's from decreased metabolism, and a thick tongue. Hematologic manifestations are going to be anemia, and this is the production of red blood cells that rely on a signal that is actually coming from the kidneys called erythropoietin. That signal is dependent on stimulation from the thyroid hormone. In fact, a just published study from scientists now believe that anemia may be the first sign of hypothyroidism or subclinical hypothyroidism. Bruising may also be noted. Some thyroid patients experience easy bruising due to a decrease in the number of or function of their platelets. Other manifestations include fatigue, lethargy, and weakness, intolerance to cold, joint pain, edema, depression, thick brittle nails, and dry coarse hair. Which statement about Hashimoto's thyroiditis is correct? So this one, I should add select all that apply to this, because the only one that is not correct is the first one. All the other three answers are correct. So it is an autoimmune disorder, it can cause a goiter, and it does have a familial link. You assess a client with newly diagnosed hypothyroidism as having an enlarged thyroid gland. Which physiological process causes this enlargement? So it would be number 3, a compensatory effort to produce more TH. Patients with hypothyroidism are at risk for cardiovascular disease because, so you have number 2, abnormal lipid metabolism and an increase in cholesterol levels. Your client presents with decreased level of consciousness. The patient has a history of hypothyroidism and was recently diagnosed with H1N1. Their labs are sodium of 120, glucose of 40, lactic acid of 20. Temperature is 96.4, heart rate 55, and blood pressure is 80/66. What is your patient's diagnosis? So we already know that this patient has H1N1, so that is going to be part of the diagnosis, but they're also suffering from a myxedema coma. This was likely brought on by the stress of their illness. The nurse monitors for which of the following as indicative of an effective treatment of hypothyroidism? So the answer would be number 4. An increasing energy level would be a sign of an effective treatment for hypothyroidism. So hypothyroidism is treated with medications that will replace the TH. Levothyroxine or Synthroid is going to be the treatment of choice. Low-dose therapy will be initiated that gradually increases T4 levels. They're going to evaluate the patient responsiveness to the medications and monitor for any cardiovascular issues such as chest pain, dyspnea, and tachycardia. This is going to enhance the effects of Coumadin because it speeds up clotting factor. Patients taking Synthroid should really be taking these about 1 hour before meals. There's also a recommendation for 2 hours after meals, but a recent study I read said that before first meal is going to be the best, so an hour before. It's going to potentiate any effects of digitalis, so you need to be cautious with use with that. And if a large goiter, they may need to do a subtotal thyroidectomy to promote airway and swallowing. So your client has a history of AFib and hypothyroidism. Which statement indicates a correct level of understanding? So in looking at the first two answers, we know that levothyroxine is going to potentiate the effects of Coumadin and digoxin. So that is not going to be correct. When it comes to spinach, that is going to interfere with thyroid function. It inhibits iodine metabolism. So it's important for patients that have thyroid issues to be aware of consuming too much spinach. And then with the last one, that is our correct answer. So we don't want to substitute thyroid medications because different brands tend to have different effects. Nursing diagnosis for hypothyroidism. So impaired skin integrity, risk for infection, deficient fluid volume, disturbed body image, bowel incontinence, constipation, diarrhea, but more so the constipation, risk for electrolyte imbalance, impaired swallowing, and hyper or hypothermia. So decreased cardiac output with these patients, you want to monitor vitals and alternate periods of activity. Risk for impaired skin integrity, that causes dry, rough skin. They can have some edema, and that places them at an increased risk for skin breakdown. And they're going to stay away from hot water, alcohol-based lotion, and rough massages. And you want to make sure that you turn these patients every 2 hours. That is the last slide for hyper and hypothyroidism. I hope you guys have a wonderful weekend.